Zion Harvey lost both hands and legs below the knee when
willing to try the still rare procedure.
Sur les conseils du professeur Lantieri, Laura s'inscrit sur la liste d'attente aux États-Unis.
Hand transplant surgery, a procedure so delicate and rare.
Giving Lindsay new hands, real ones, from a donor.
There's an expression in surgery. Preparation is the only shortcut you need.
Our hands are endlessly expressive. They help us convey thoughts and feelings, soothe with a gentle touch, enable us to care for ourselves and for others. There's perhaps no better way we express ourselves than through our hands. Living a life without hands, a person loses a sense of self. Independence is challenged. Dependent on others for the most basic tasks, it is impossible not to become isolated from the outside world. A vital method for establishing human connection is lost.
I've accepted the fact that my feet are gone. Like, that's acceptable to me. My hands is not, it's still not. In my dreams, I always have my hands.
I know from the experience we've had at Penn with patients who have had hand transplants, that just the mere fact that their body image is restored, they can wave, they can gesticulate like I'm doing when I'm speaking. That's a pretty profound thing when you think about it.
As one of only a few medical centers in the world where this surgery is performed, Penn Medicine is breaking new ground for transplant patients by connecting the top medical experts locally and around the world to conquer new frontiers in the emerging field of vascularized composite allotransplantation, the transplant of body parts such as hands and faces to recipients who have lost these parts. The discipline of vascularized composite allotransplantation uses an operating microscope to guide the connection of arteries, veins, and nerves. It is a new discipline, as innovative and exciting as any in medicine today. Hours and hours of surgical rehearsal and practice over 2 years' time allow the team to prepare for each patient's operation. Envisioning the possibilities has become the life's work of Penn surgeon, Dr. L. Scott Levin.
I trained first, did a few years of general surgery where I was exposed to pediatric surgery. And then I trained in orthopedics and did my pediatric orthopedic surgery at the Shriners Hospital System. I did all the congenital hand surgery at Duke for almost 20 years. Then came to Philadelphia and being trained both in orthopedics and plastic surgery and doing lots of pediatric microsurgery, pediatric hand surgery, pediatric reconstructive surgery. The world of hand surgery, of course, is in adults and children. This is an absolute passion of mine, and I've always loved that. And this is just the next extension of hand transplant surgery.
Connecting all the dots to make this complex, multidisciplinary surgery a success is a monumental undertaking. By marshaling the best and brightest in their respective disciplines, Dr. Levin has assembled a team that is second to none and orchestrated it to perfection.
In TEAM, the acronym is Together Everyone Achieves More, TEAM, and I've always believed that. You know, this is a cast of many entities, our internal medicine colleagues, anesthesia, nursing, social work, pharmacy. These kinds of operations touch everyone in a health system. So we had really incredible surgical talent. And we're very, very fortunate again in a place like Children's Hospital Philadelphia that we can actually compose a team of people who can carry out this operation.
Last summer, Zion made history, becoming the first ever child recipient of a double hand transplant. The nearly 11-hour procedure paving a long road to recovery, marked with a rigorous therapy regimen.
Earlier this month, he got to throw out the first pitch at the Baltimore Orioles game.
Laura s'est très vite approprié ses nouvelles mains. Elle commence à plier ses doigts, à bouger ses poignets, à tenir des objets.
So have you looked yet? No.
I've only peeked down at this one thumb.
They feel like normal fingers, normal hands. This is more than we could ever hope for. Her blood pressure's good, all the parameters are good related to how the blood flow is in and out of her new arms. I mean, this is if you will, a picture-perfect course so far.
Hi, guys.
What has happened at Penn Medicine is not science fiction. It is real science, involving real people. Here, now, today. As in any emerging field, there is still much more to be learned. But with Dr. Levin's leadership in this highly specialized discipline, Penn Medicine is going beyond excellence and eminence to preeminence, giving his patients a chance they could only dream of a short time ago, to reconnect with others and with the world.